Hi guys, welcome back to my YouTube channel. If you're new here, my name is Dr. Shivapriya and I'm an assistant professor in psychiatry in India. I personally absolutely love learning about financial management. I think financial transparency within the healthcare system is very important, but it is slightly a controversial topic. So I want to have two disclaimers for this video. The first disclaimer is that the number one duty of a doctor is to provide quality services to the patient. There should be nothing that compromises that. So keeping this ethics in mind, I'll be discussing how as a doctor you can earn a good income to support your family members. In this video, I'll be discussing strictly ethical choices only. So the second disclaimer is that I don't think my salary or my income should determine your PG branch choice. Now, I believe that PG branch should be chosen based on what your interests are and what you're comfortable doing for the rest of your life. This is my personal opinion, the reason being that I think when you're going to spend enormous number of hours and days and years together in a profession, it's very important that you actually like it and decide your choice based on what you like and enjoy as opposed to how much income potential there is. The income potential depends on individual choices and preferences as opposed to the branch in itself. Like whichever branch you take, although there is a little bit of difference in terms of pay in different branches, ultimately the amount you earn depends on what kind of a practice you decide to have. So what is my income? So as I said, I work in a teaching hospital. So my job is primarily academic research and clinical services, and I earn about 1.2 to 1.5 lakhs per month doing that. After all the tax deductions, healthcare insurance and things like that, I get about 1 to 1.2 lakhs in my account. It's not the same every month or every year. I do recognize that for some of you this amount may be more, and for some of you this amount may be like, oh my god, it's so less. But honestly, for me, I'm very happy with this amount and I'm content with it for the phase of life that I'm in. If it means that I have to earn a little bit of lesser money than private practice and I need to spend that money more frugally to support my family, but at the same time, I'm getting to do the things that I enjoy and I like and brings me joy, then that's okay. Then I think this is a good deal for me. Now, what are the factors which affect your income potential? And what are some of the things that you can do ethically to enhance your income potential? Now, the first thing is the kind of institution or kind of setup where you practice. In the current state of things, private practice is perhaps the most lucrative in terms of just the income potential. And even migrating abroad, especially to Australia or UAE, has good income potentials as opposed to joining a research or a teaching position here in India. Sometimes in the teaching institute contract, you can have a statement that says that you're not allowed to practice outside, which means that they'll give you a non-practice allowance. But there are also institutes which allow for you to have a private practice, in which case the income is a little lesser, but you're allowed to open a private practice in your free time and earn more income through that. Now, within the realms of private practice in itself, like suppose you decide that, okay, no, private practice is what I want to do. And now what can I do to improve my income potential? After discussing with a few colleagues of mine, what I've understood is the number one factor which determines your income in private practice is availability. How available are you to patients? And so that as and when they're in difficulty, the more and more available you are to them, that fosters a good trust and good rapport with you, and it's likely that they'll come back to you and they'll give you a good referral, and as a result you get more and more patients. Also, another thing that you can do to earn a little bit more is perhaps visiting multiple hospitals. So if you're a visiting psychiatrist to many hospitals, that could help you. So choosing to have an inpatient or a de-addiction facility can again give a boost to your income. But bear in mind that becomes more like a business where you're not just doing the medication or the treatment aspect of things, you're also managing the business as a whole. So including the staff nurses under you, the psychologists under you, the kind of food that is provided in the hospital or the inpatient facility that you're managing, and you have the skill set to do that kind of tasks, then definitely you can go for that. Another thing you can do to increase your income is possibly getting trained in specific psychotherapies like DBT, etc. Another treatment modality is neuromodulation treatment, which is charged a little higher than just prescribing a medication. Both these things, that is getting trained in specific therapies and neuromodulation treatment, has an initial investment cost. So you need to take that into consideration when you decide to provide these services in your treatment setup. Suppose you like teaching, an option that you can consider is entrance exam coaching. Again, the income there is much higher, how much they provide you per class that you take. The next point I want to talk about is networking and having a positive social media presence. In private practice, you need to set up in place a good referral system. Most people, even today, are not very comfortable visiting psychiatrists directly. What are they likely to do? They'll either visit the primary care physician, they're likely to visit their family doctor, they may visit a psychologist, visit a counselor, okay? They may prefer to visit even a faith healer. And when you create awareness programs and you have a good networking skill, you interact with people, you make people known of the available services, then of course that will help improve the referral systems. And when people are struggling, they're likely to refer to you if they know that this service is available. Lastly, all this money that you're earning, how are you saving and how are you investing? Because with the current inflation and things like that, as you know that the income that you earn, it's very important to invest it wisely so that the money that you earn today does not diminish in value over time. If you like this video, make sure to subscribe. What do you think about this topic? Let me know down in the comment section. Have a nice day. Take care. Bye-bye.